David Porter from the Illinois State Medical Society. Mr. Porter, please proceed.
Well, thank you, Mr. Chairman, and members of the committee, and good morning. I'm David Porter. I'm the Senior Vice President for Health Policy at the Illinois State Medical Society, and I appreciate the opportunity to be here today to share our perspectives on the critical issues around the department that recently completed physician license renewal and the licensing process overall. One of the issues of utmost importance to physicians is the overall effectiveness or lack thereof of the licensing and renewal process. We hear from many physicians that the Illinois licensing process is overly difficult, takes too long, and provides an applicant with virtually no transparency as to the status of one's application. So say you're a medical resident or a young physician considering coming to Illinois, or perhaps you've just completed your education and training here in Illinois and you're considering your next step. Our state's ability to efficiently and effectively license our physician population may have a significant impact on the choices these physicians make about their careers. Those decisions will in turn impact our state's ability to maintain a sufficient supply of licensed physicians to treat the people of Illinois. Now, ISMS has been in regular communication with the department of late, mostly specific to the recently completed license renewal, and we always strive to maintain a dialogue with them on their overall effectiveness, and we do share with them regular feedback from our members about their specific interactions with the department and the process. We also try to regularly assist the department where possible in promoting or publicizing important information to the physician population. With regard to the processing of license applications, including the most recent renewal, we've identified three primary issues of concern. First, there do not appear to be enough staff at the department to deal personally and directly with applicants experiencing difficulties with their applications or renewals, or with the department's online renewal portal. ISMS recognizes the need for additional appropriations that would allow the department to hire additional staff to manage the licensing processes, and we would be supportive of legislation that seeks to address this need. Second, our members tell us that they have experienced longer wait times than in past renewals, and this is particularly concerning since the 2023 renewal started in early April, nearly 2 months earlier than in past renewals, and yet the department had to extend and delay that renewal for a full month. These wait times are particularly longer for those awaiting issuance of controlled substance licenses, and it's also true for applications from physicians who have medical licenses in other states. Most concerning to our members, I think, is an overall lack of transparency. Applicants tell us that there's no real way for them to obtain status updates on their applications or renewals, and there's virtually no chance to be able to connect with someone at the department by phone or email who can provide such updates. Most frustrating to new applicants is that they are rarely notified when their applications are deemed to be insufficient or incomplete, which adds days or weeks to when they can expect to obtain a license. Aside from the additional worrying about applicants anxious to start new jobs, such delays might deny a hospital or a community access to a needed specialist or a primary care physician. Please know that the State Medical Society strongly supports efforts that might reduce barriers that may prevent Illinois from recruiting or retaining a sufficient and robust physician workforce. We stand ready to work with the General Assembly and the department to improve the process for all new and renewing resident and physician licensees going forward. And I thank you for inviting us here today.
Thank you, Mr. Porter.